Pharyngitis is one of the commonest presentations in clinical practice, and most patients are treated with antibiotics. The fever, pain, and Centor criteria are clinical scoring tools that can help to identify the people with a sore throat caused by streptococcal bacteria who are more likely to benefit from antibiotics. The fever pain criteria consist of fever over the past 24 hours, purulence on the tonsils, patient seeking medical attending within 3 days of onset of symptoms, significantly inflamed tonsils, and the absence of cough or coryzal symptoms. Each of the fever pain criteria score 1 point with a maximum score of 5. Higher scores suggest more severe symptoms and likely bacterial cause. A score of 0 or 1 is thought to be associated with a 13 to 18% likelihood of isolating streptococcus, whilst a score of 2 or 3 is a 34 to 40%, and a score of 4 or 5 is thought to be associated with a 62 to 65%. The Centor criteria consist of tonsillar exudate, tender neck lymph nodes, history of fever over 38 degrees Celsius, and the absence of cough. Each of the Centor criteria score 1 point with a maximum score of 4. A score of 0, 1 or 2 is thought to be associated with a 3 to 17% likelihood of isolating streptococcus. A score of 3 or 4 is thought to be associated with a 32 to 56%. Patient with a Centor score of 0, 1, 2 or fever pain score of 0, 1 are unlikely to benefit from an antibiotic course. So patients should not be given antibiotics, instead advised to seeking medical help if symptoms worsen rapidly or do not start to improve after a week. Patient with a fever pain score of 2, 3 are likely to benefit from an antibiotic course, so patients are advised that immediate antibiotic treatment are not needed. However, if the symptom worsens for not improving after 3 to 5 days, a course of antibiotics can be started. Lastly, patient with a Centor score of 3, 4 or fever pain score of 4, 5 are most likely to benefit from an antibiotic course. Hence, an immediate course of antibiotics will be prescribed to the patient. Thank you for listening, and see you next time.